Hello, welcome. This is Health Matters with me, Dishen, Kumar, and we are in Hospital Kuala Lumpur today to talk about chronic kidney disease or CKD. Now, CKD affects a lot of us. We're going to be talking to a physician, Dr. Sunita, and also a dialysis patient to just give us a very good insight on chronic kidney disease and how it's actually affecting everyone in Malaysia and why is it affecting so many people in Malaysia, and maybe steps that we can take so that we don't get chronic kidney disease. So join me in today's episode. This is Health Matters with me, Dishen Kumar. Alright, thank you Dr. Sunita for joining us today. Can we start off with, maybe you can tell us more about chronic kidney disease or CKD and the status of kidney disease today?
Okay. Chronic kidney disease is a condition in which there's damage to the kidneys or reduced kidney function, which has persisted for at least 3 months. So basically, chronic kidney disease is a disorder that persists for a long time, as opposed to another condition which is known as acute kidney injury, where the kidneys suffer an injury but have the capacity to recover, and they do, right? So currently in Malaysia, we know that the prevalence of CKD is on the rise. There have been population studies that have been conducted. The first one in 2011, in which it was found 1 in 9 adult Malaysians had some form of chronic kidney disease.
1 in 9?
1 in 9.
Wow.
And when this study was repeated in 2018, the incidence has actually gone up now to 1 in 15 of the adult population being affected by chronic kidney disease. The main causes of CKD in Malaysia would be diabetes and hypertension. Diabetes accounts for about 65% of all new cases of end-stage kidney disease, and hypertension accounts for about 19% of these cases. But there are other causes. These include glomerulonephritis, which is a sort of inflammation in the kidneys. There are also inherited diseases such as polycystic kidney disease, obstructive kidney diseases due to kidney stones, or in some of our elderly male population, there is enlargement of the prostate gland which causes obstruction. And then there are various other less common causes like autoimmune diseases like lupus erythematosus, etc.
Okay, what is a lifespan from a person who has been diagnosed with CKD?
Okay. If you have CKD, there are several stages in terms of the kidney disease. The stages range from stage 1, in which there's a fairly normal kidney function, down to stage 5, which is what we call end-stage kidney disease. So actually, the early stages of CKD probably don't have an impact on mortality, but once you are in CKD stage 3 onwards, there is a reduction in life expectancy of patients. That's not because of the kidney disease by itself, but it's actually because there's an increased risk of cardiovascular disease, which is disease of the heart and the major blood vessels. There is no cure for chronic kidney disease, but it is important in the early stages that we diagnose the disease early. So in that sense, early detection is very important. So we always encourage the public, those who are at high risk, and that includes people with diabetes, hypertension, family history of having chronic kidney disease, those autoimmune diseases I mentioned earlier like lupus, rheumatoid arthritis, people who take chronic painkillers on a long-term basis. These are the ones who are a bit at risk of chronic kidney disease, and they should be going for screening. So if you pick up the disease early, there are a number of medical therapies we can institute to prevent the kidney disease from getting worse, right? But once it gets to a certain stage, then the remaining kidney function is not enough to sustain life. That's when dialysis or transplant becomes necessary. So these therapies at the advanced stage are not curative. They are simply there to replace the normal kidney function. But among the options, we would say that transplant is the best option because it improves patient survival and also gives them a better quality of life. Okay, if we look at data, we have a Malaysian dialysis and transplant registry. So we look at the data from this. We can see, like in 2015, of all the patients on renal replacement therapy, about 92% were on dialysis, and only 8% were actually those who had received a kidney transplant. So although kidney transplant actually has been available in Malaysia since the last 4 decades, right? what has happened is dialysis services have expanded, but kidney transplant has not actually progressed that much. I think the main issue is really a lack of the donors for patients with end-stage kidney disease.
So, lack of donors, people are not really signing up to be organ donors or things like that?
Yes, in that sense, there's been a drive to try to increase people to pledge to be organ donors, but quite a lot of change still needs to be made in terms of changing the public perception to come forward and pledge as organ donors.
Okay.
Yeah, you mentioned obesity, and that's another one of the diseases that's on the rise in Malaysia. So, in fact, if you look at statistics, there is this survey that's repeated called the National Health and Morbidity Survey. So, the last one that was done in 2015 showed that nearly half of the Malaysian population is actually either overweight or obese. And obesity has direct and indirect links to chronic kidney disease. Indirectly, obesity will increase those diseases like diabetes and hypertension, which are the main risk factors for chronic kidney disease. But directly itself, obesity causes more stress on the kidneys. It can cause protein to leak in the kidneys and also certain hormonal imbalances that contribute to the development of kidney disease. There's also an increased risk actually of renal stones or kidney stones and kidney cancers in patients who are obese. So this is the link to between obesity and chronic kidney disease.
What about diabetes and hypertension? What are the links there for kidney disease?
Okay. Well, diabetes and hypertension, both of them are long-term chronic disorders, so they can actually cause damage over a long time to the kidneys. They also cause damage to the cardiovascular system, and sometimes it is actually some of the damage to the blood vessels that actually impair the flow of blood to the kidneys as well. So they're both again direct and indirect effects to the development of other diseases that impair kidney function.
It's an after effect of those diseases as well.
That's right.
Okay.
This is the thing that we would like to emphasize to the public really, that chronic kidney disease is sort of a silent killer. In the early stages there are very few symptoms. It's only when the disease reaches advanced stage that a patient may have non-specific symptoms like itching, swelling of the ankles or the face, perhaps decreased appetite, nausea and vomiting. So that's why the message is really to...
But those are also very general,
yes,
general symptoms.
You're right, they're very non-specific.
Yeah.
So quite often patients present in a very advanced level of kidney disease, which is a shame because if we had known earlier, there was a lot of things that we can do to try to prevent them from getting to that point. Yeah, I guess the most important thing is to maintain a healthy lifestyle so that you prevent diseases like diabetes, hypertension and obesity in the first place, which are leading to chronic kidney disease.
Are Malaysians being healthy in that sense?
I think that I would be positive. I feel that there's increased public awareness.
Okay.
Certainly, when I go out for a walk, I see many more people nowadays, and a lot of races and runs on the weekends. It's really taken off in a big way. So I'm hopeful.
Okay.
And I think for those who already have diabetes, hypertension, then the message would be to control the diseases well, so as to prevent the chronic kidney disease from starting or from getting worse. That these would be the main things. For those who have chronic kidney disease or even those without, another word of caution is about taking painkillers on a long-term basis or taking over-the-counter health supplements. Some of these supplements have not really been tested properly, so they actually might have detrimental effects on the kidneys.
Okay.
I would always say, if in doubt, then just ask your doctor for advice whether you should be taking supplements or not. Okay, there has been some news, I guess, about stem cell research that would offer the possible cure in the future for chronic kidney diseases, but I think this is very much in an experimental stage at this point. But certainly in terms of transplant, we have had an increasing armamentarium of immunosuppressive agents that have reduced the rates of rejection considerably. And in terms of dialysis therapies, both peritoneal dialysis and hemodialysis, there are advances in technology of the machines or in terms of the PD fluids that will enable better outcomes for our patients. The National Kidney Foundation's focus is very much on increasing public awareness about chronic kidney disease, how to prevent it and how to manage the disease. So it often has health screening activities, public awareness campaigns and things like that So they help to educate the public, but they also do this in association with health professionals to also increase awareness about how to manage the chronic kidney disease. National Kidney Foundation often works in collaboration with the Malaysian Society of Nephrology. Now, the Malaysian Society of Nephrology, or MSN, is actually a professional society that consists of all nephrologists in Malaysia, whether they're in private, public, or the NGO sectors. And it's one of its focus of its activities is in terms of educating healthcare professionals about chronic kidney disease, but also acting as an advocate for maintaining proper quality and care of kidney diseases in the country. Okay, I think first of all, if they have access to the internet, there's a lot of information that can be gained from certain websites. The National Kidney Foundation website is www.nkf.org.my, and the Malaysian Society of Nephrology's website is www.msn.org.my. Apart from that, the government also has a portal, My Health. So if you just Google that, there's quite a lot of information there. For those who perhaps don't have the access to internet or prefer face-to-face consultation, I think they can actually approach most doctors in government medical clinics, like the KK Klinik Kesihatan, and discuss with them whether they are at high risk and would they be able to get screening for chronic kidney disease.
Thank you, Doctor.
Thank you.
So thank you, Siva, for joining us today. Maybe we can start off for the people watching. Can you please introduce yourself?
Yeah, I'm SIVAKUMAR RAGHAVAN. I'm from Raub, Pahang. I was born in Raub, and in 91 I came to KL to pursue my studies as a teachers training college. After that, I've been in KL.
Okay.
Yeah.
How old are you?
I'm 48, going to be 49 this year.
You don't look 48, by the way. You look young.
Alright, satu teh sini.
Okay, how long have you been on dialysis?
Alright, yeah, I've been on hemodialysis since these 3 years. But if I were to rewind and look at from the beginning, I was diagnosed as chronic kidney disease (CKD) in end of 2008.
Okay.
All right, end of 2008, I was diagnosed, and I coped with it to avoid being dialyzed or dialysis for nearly 5 years. So the things got worse in 2011 end, and 2012 I had to go on dialysis for 6 months, but I opted for CAPD. Alright, continuous ambulatory peritoneal dialysis. Now, for 6 months I was on CAPD. Then we did transplant. My wife donated her kidney to me. In 2012 July, we did a transplant. Alright, then after 4.5 years, it failed. Then since 2016 September, I've been on dialysis, hemodialysis. Yeah, one fine day after having my breakfast, I was walking back from that stall that I had the breakfast. I was feeling like giddy and it's like kind of high, you know. I was wondering how come I'm high without having any booze or whatsoever early in the morning. So I checked with my doctor, and we discovered my blood pressure was high. In 2009, they did MRI, they did biopsy and all, and discovered that the cause of my chronic kidney disease was IgA. So I was told that it was due to IgA, it's immunoglobulin nephritis A. It was a it was total misery because I've never in my life, at that point I was 38 years old, and never that I had admitted in a hospital, you know, and I'm not a person where I fall sick and I don't complain sick. I never had been like that. Even if I have flu or fever, it is maximum 2 days. I'm up and I, you know, I am that kind of person, you see. So when I was told that I have a major illness, it was quite devastating, right? But at that time, it was not very much about me, because I had married and my wife is there. I was more concerned for her, right? So she was, I opened it up and told her. She was devastated, and she was like every time going on her own and then crying, you know. Having you being healthy, you take things for granted, right? You don't know what you will be losing or you won't be having when one of your organ is not functioning. It's when that happens you realize, oh my God, you are, you know, restricted, or you have lots of limitations of what you can do, what you cannot do, and whatsoever. You see, so that's where you really value life and value your organs. You know, I've been a person where I'll always take up challenges. All right, I'm a person where if there's something goes wrong, I will just go. You know, I'm a person who threw a government job and say I want to just be on my own, and where everyone say, hey, what, you're leaving government job, being a teacher and all. So I'm that kind of person. I take up challenges, you see. So when this thing came, as I said, the next thing was not about around myself. It's about my wife, you see. So I have to do something for her to keep her motivated and show her there is hope. And there is this
So
not the end of the world.
To motivate your wife, it also motivated you as...
Yeah. So it's like, yeah. So I keep on seeing what's next, you see.
So who made the decision that they want to run? Did
So
your wife
one
say...
fine day that Sham came together with me, and then Dr. Rosna was there, and she told, and then I told that she's A and I'm B. So it's different blood group, no point talking about it. So, you know, I don't want to go through this. You see, the transplant especially involving them to go through this. So then, but after a month or so, Dr. Rosna was telling me, I got a good news, that ministry had approved the budget for the incompatible transplant, despite that it's a big budget. So I was like shaking my head, and my wife got to know, and then we then went on and agreed to the transplant.
Okay. Final question, what is your advice for other patients going through dialysis or patients who have CKD? What would be your advice for them to fight forward and to handle the disease?
Yeah, I have two perspectives on this, right? One is for the patient, right? Of course, as a patient myself, we, as I said earlier, we have to take it to ourselves, all right? Now, whether how old you are, all right, whether whatever that you are going through, whether you have illness or don't have illness, you have to take things to you, take it as your responsibility, all right? So, and not point the fingers and say what others should do for you and put the blame on others. All right. So Now, most of the patients, all right, they take things for granted in terms of even their medication. I walk around sometimes and see that some of them were having some other complications. When I talk to them, they are not aware about their own medication. Some of the medications and some of the things that they should do and shouldn't do. Now, very easily they can say that the doctor didn't tell me.
But they need
There
to
are
find out
many
for
things
themselves.
that the doctor didn't tell me as well. There are many things that I have to question. I have to ask these the HAs and who are coming
Understand.
a lot of questions, and I ask those who have been doing dialysis for 10, 15, 20 years. I got a lot of answers while seeking for what's needed. You see, so I seek rather than I wait for somebody to come and tell me what to do, and if nobody tells, I say nobody told me what. You know, so I'm putting the blame on others.
Understand.
That shouldn't be the way. You should see what you need.
Understand.
So I would love to end this with this the comparison of Malaysia and Turkey.
Okay.
All right. So it's like Malaysia started transplant same as Turkey in 1975.
Okay.
All right. At that time, every year we have been doing 50 transplant. Malaysia as well. Today, we are still stuck with less than 100. Do you know how many transplants have been done in Turkey?
How many?
Close to 4,000 to 5,000. How that's possible? You know, I always compare that to IJN. Today, every other private hospitals are doing heart surgeries. That's because the surgeons, new surgeons are being trained and produced from IJN. We don't have that for transplant. All right. So if there is some thought has been given from the high level Ministry of Education, and more emphasis is given for transplantation, and more surgeons are developed in the hospitals like HKL, I believe in 5 years down the road or 10 years down the road, we won't be stuck to below 100. You know?
All right. Thank you, Mr. Siva, for your time.
Yes. Thank you.
All right, this has been Health Matters with me, Dishen Kumar, and today we talked about chronic kidney disease. Now, I hope this episode has gave you an insight on the condition, on the disease, and how deadly it can be. We talked to Dr. Sunita, who gave us a very interesting medical perspective, and also we talked to Mr. Siva, who shared his personal story with his battle with the disease. Now, one thing that I personally can take away from this episode is we cannot take our organs for granted, and we will always take care of ourselves and maintain a healthy lifestyle. Until next episode, my name is Dishen Kumar. Thank you for watching. Goodbye.